Welcome, everyone. I'm Keith Seinfeld with Public Health, Seattle and King County. This is a media telebriefing for Friday, the 26th of June, 2020, about COVID-19 spread in King County. A status update. We'll be talking about the increase in cases and the need to limit close contacts of ours and all of our loved ones. Welcome to the media. We will be hearing for about 5 to 10 minutes from our health officer initially, and then we will take questions from the media. The way this will work is if you want to ask questions, use the Zoom function for raise my hand. You should find that Zoom function in the bottom of your screen for raise my hand. That will put you in the queue. And when it's time for you to ask your question, I will call on you by name. Ideally, we'll hear both your name and the news organization you're affiliated with, and we'll prompt you to unmute yourself at that time. So be prepared to unmute yourself when you're called on and you'll ask your question. We have about a half hour today. We have a hard stop time at 1 o'clock. So with that, I'd like to introduce Dr. Jeff Duchin. He is the health officer for Public Health, Seattle and King County. His name, last name is spelled D-U-C-H-I-N. So it's Dr. Jeff Duchin, Public Health, Seattle and King County. And Dr. Duchin, let's hand it over to you.
Thank you, Keith, and thank you everyone for joining. Can you hear me okay? We're good. Okay, great. So I'm going to provide some information about the current status of our outbreak and my interpretation and some thoughts, and then hopefully have lots of time for questions. So after a decreasing trend in the number of cases since the peak in late March, there has been an increasing trend over the past 11 days or so. For the week of June 14th through 20th, we saw 156 more cases compared to the previous week, which represents a 60% increase. During this time, COVID-19 hospitalizations and death trends remain stable. We're not seeing an increased impact on our healthcare system, which remains very well-resourced and able to take care of COVID-19 cases and others who might need healthcare. And there's no reason why people should avoid seeking healthcare for any condition at this point. Our recent cases are from all areas of the county, with the largest increases in young adults and City of Seattle residents. In the past 14 days, approximately half of all cases have been in the 20 to 39 age group, which is a significant change. This is compared with about 33% in that age group in the overall outbreak to date. We have not been able to identify any specific venue or specific risk factor as a cause of this increase. Household exposures continue to be the most commonly reported risk factor. We also see cases among our essential workers and other workers, and those affiliated with long-term care facilities, particularly now during the point prevalence surveys that have been mandated by the governor. One thing to take into consideration in the context of the increased case reports that we're seeing is that our testing rates have doubled since June 7th. So just in the last 2 weeks, during the time we've been observing this increase, we've also had a very significant jump in testing availability, which is very gratifying. We've gone from about 15,000 to almost 30,000 tests per 100,000. And a big chunk of that increase is in the City of Seattle, where we've had more case reports. Good news, the percent positivity among the tests that we're doing remains low. A rising positivity is an indicator of increasing transmission, and we're not seeing that at the moment. Our positivity rates in the face of increasing testing are remaining stable. I'd also like to just remind you, if you're not already aware, that we've got 2 free testing sites going on in the City of Seattle, and those testing sites since June 1st have performed approximately 17,000 tests and are seeing a relatively low positivity rate, about 1.2%. So this is a worrisome trend, obviously. No one wanted to see cases increasing. And what this means, increasing cases over the past 2 weeks, means we're having more contact with one another, but not taking more precautions. And that's giving COVID-19 too many opportunities to spread from person to person. And there seems to be a misperception that because we're reopening, the risk of COVID-19 has receded. But the truth is that the virus is still widespread in the community, and the risk for infection remains serious. COVID-19 connects us all through the air we breathe, and we're depending on one another to prevent infections and stay safe. Everyone needs to do their part. We're part of a highly interconnected community, and the impact of transmission in one setting, such as coffee shops, construction sites, or businesses, is felt across other sectors like restaurants, manufacturing, and recreation, and vice versa. The challenge we face from COVID-19 will be long-term, and it requires us to fundamentally change the way we interact with one another for the foreseeable future if we're to move forward safely. We can't completely eliminate the risk of COVID-19, but we can and must understand that risk and take steps to decrease it. Unless we can successfully manage the risk of COVID-19, it will be very difficult to continue to reopen and move forward. Close contact with others, longer duration of contact, poorly ventilated spaces all increase the risk of COVID-19 transmission. And this is why it's so important for all work sites, businesses, restaurants, and other community spaces and activities to do whatever they can to reduce opportunities for the virus to spread as we reopen. Physical distancing and staying home remain the most powerful prevention measures, along with the use of face masks in public and good hand washing. I'm going to pause and use the rest of our time to answer your questions today. Thank you again for joining us.
Thank you, Dr. Duchin. And while we're waiting for media to use the raise my hand function to get in queue for questions, I want to point out, in addition to those 2 drive-through testing sites in the city of Seattle, we've actually, public health has worked with a number of our partner health agencies around King County and have more than 15 locations where there's free open access testing for people who are having challenges either because they do not have a healthcare provider or because some other challenge with their healthcare provider. Those sites are all listed on the public health website, and we'll try to get that link to you in the message box here. But if you go to the COVID-19 website for Public Health Seattle and King County, there's a very clear link to the testing sites. I'm going to start out by calling on Graham Johnson. Graham, could you, we're going to ask you to unmute yourself and state your name and your station.
Thank you, Keith. Yeah, it's Graham Johnson from Cairo TV. Thanks, Dr. Duchin. Last week, you were able to give us some reassuring messages about the potential of the demonstrations being a place where there was transmission. You'd said the numbers were very low. I'm just curious if you can give us the latest numbers on that, and are we at the point now where we can basically stop worrying about that? I mean, you know, in terms of that being a potential for extra transmission?
Well, I don't think, thanks for your question, first of all. We don't have any additional evidence to suggest that the large gatherings outdoors, where many wore face masks, are contributing significantly to this spike. I think it's safe to assume that transmission can occur anytime people come together. What we've seen is a very small percentage of cases that have been linked to those gatherings. When we do our investigations, we found approximately 34 people who reported some participation in a protest or gathering of some sort over the period during which they've been occurring since late May. That's out of over 1,000 cases. And among those people who've been tested by the City of Seattle's free testing site, they've had very large number, approximately 3,000 tests among people who say they were participating in a protest or a large gathering linked to those protests. and have seen less than 1% positivity. Now, of course, it's possible not everyone who's linked to protests is telling us during the case investigation, so the data may be imperfect, but we certainly don't have evidence that those gatherings outdoors were triggering this increase that we're seeing. I think that at the same time, people were beginning to do a lot of activities across many sectors of our community, in the workplace as workplaces opened up, in recreation and socially. And just anecdotally, I've observed and others have communicated to me that they see lots of people gathering rather closely without using masks. So all of these things happening simultaneously does make it a little bit difficult to tease out any one factor compared to others. But neither here in King County nor elsewhere in the country where public health authorities are looking for evidence of transmission increases related to the protests have we been able to document that or find strong evidence suggesting that.
Thank you, Dr. Duchin. And again, for the media, use the raise my hand function to if you'd like to ask a question. And while people are getting into queue, Dr. Duchin, you mentioned about a number of the increase in younger adults testing positive, and we've heard elsewhere in the country about concern about bars and restaurants. Do we know anything here locally that would make us concerned about bars and restaurants?
Well, nothing scientific. We asked people about their activities during the time during which they may have been exposed to COVID, and there's a very long time interval that someone is vulnerable to infection. So there's a 14-day incubation period. So when we ask folks about activities, as you can imagine, people have done a whole lot of different things in that time interval. They've been out and about in restaurants, many have been working, many have visited other people, some have done social and recreational activities. So it's very difficult to tease out which of those very many interactions that people have had in the community may have been the one that led to COVID transmission. And for that reason, it's critically important that everyone understands that COVID is widely prevalent. It's commonplace right now in our community. And you should assume that when you go out in public and have contact with others, you may be exposed to COVID. And everyone, therefore, needs to wear a mask when in public to decrease the risk of transmission from people who don't know they have the infection and protect the others around them, and to prevent vulnerable people who are at higher risk of hospitalization and even death from becoming infected. But at this point, we can't point to any one hot spot or even a few hot spots in the community that seem to be responsible for a majority of the new cases that we're seeing. It appears that there are many, many opportunities for this virus to spread as we are getting more active, going back to work, and doing more things socially and recreationally. Unless we understand that the risk is still serious and that we must take steps to manage that risk, we will continue to see cases. And ultimately, I think there will be an impact on our healthcare system. And therefore, we will not be able to move forward safely. So it's critically important that people do whatever they can to manage that risk and understand that as we move forward, the risk is still present, it's high, and it will increase if we don't take prevention steps.
Thank you. We have a question from Anna Boyko-Wyrock from KUOW. Anna, we're going to ask you to unmute and go ahead and ask your question.
Can you hear me?
Yes.
We do.
Oh, you can. Oh, whew. Sometimes I have a lot of trouble with these things. I am wondering, given how dramatically cases are rising in other parts of the country, is there any discussion to start screening domestic passengers at SeaTac and asking them to quarantine?
We have not discussed that. I haven't heard anything from our state colleagues. Clearly, reintroduction or introduction of COVID into the community from outside is an issue. We have plenty of hotspots in Washington State where people can travel, and of course, people will be traveling nationally. But we have lots of transmission here as well. So it's not clear that the risk from introduction elsewhere would be higher or high enough to do that, those types of quarantines at the moment. It's not totally unreasonable, because you might say, well, anything you can do to lower cases is meaningful, and that's true. But we haven't had that type of discussion yet, because I think we're still focusing on decreasing the risk in our own community, where transmission is significant now, and again, not clear how much additional risk we would face from importation. If and when we get down to a low level of transmission in our community, and we feel that importation would set off new chains of transmission, that would be a very important thing to do.
Thank you. We have a question from Joseph Thompson. Joseph, could you unmute and state your organization as well?
Yeah, this is Joey Thompson with the Everett Herald. Just wondering, Dr. Duchin, how concerned are you that the news we're hearing now that young folks are sort of maybe reigniting community transition could lead to 2, 3, 4 weeks from now, seeing that the cases aren't just with young people and we've sort of gotten back to the point where we were, where community transmission is widespread and we're seeing hospitalizations and mortality increase?
Well, a great question. I'm very concerned about that. One of the challenges with this outbreak is we're looking at cases that were acquired a couple of weeks ago. And after we become aware of a case, then there is another lag time between the time someone becomes infected and they get tested and reported, and then may need hospitalizations or spread the infection to someone else who's more vulnerable, who would be more likely to be hospitalized. So this is something we look very, very carefully for, and I would just want to remind everyone that the most important measure that we have is the measure of our healthcare system status. And we look at visits for COVID-like illnesses and hospital admissions and the availability of beds in the hospital every day. And if we do start to see trends that are beginning to decrease the ability of our healthcare system to respond, or that even suggest that we may be headed in that direction, we want to take steps very quickly to change course, because again, it takes 2 or 3 weeks or even longer to have an impact on hospitalizations. So it's very difficult to forecast the trajectory of this increase that we're experiencing currently. Younger people, to the extent that they stick to themselves, will have less of an impact on hospitalizations and deaths, but to the extent that they interact with others and spread the virus to others, and I think it's likely that that will happen to some extent, we will see an impact on our healthcare system, and we're watching that very closely. And I just want to, can't emphasize enough the importance of acting early if we see that type of trend because of the delayed impact. So I don't think we'll get back to the level of disease that we saw in late March and early April. I think we would, as a community, want to take action before we reach that point.
Thank you. Reminder to media that if you'd like to ask a question, use the raise my hand function at the bottom of your screen in Zoom. We'd have time for probably 2 or 3 more questions. Dr. Duchin, you've spoken a few times about our need to, some of the things that we can do to prevent this from getting worse. We've seen other states where they've reopened, where things are getting more concerning. What are the 1 or 2 or 3 things you think we need to do to be successful in this phase 2 of reopening?
Thanks, Keith. Well, clearly, we need to understand that the risk of COVID-19 has not gone away. That just because we're reopening, people should not get the misimpression that that means the risk is lower or that things are safe. We're reopening despite the fact that COVID persists, and what that means is we have to take special precautions and manage that risk. The most effective thing we can do is decrease our interactions with others in the community to the extent that you can. staying home is still the best way to prevent transmission of COVID-19. If you need to be out and about, or you choose to be out and about and accept that risk, at some level of risk, comes with every interaction. So maintaining that space of 6 feet between yourself and others is critically important. Wearing a face mask in public whenever you cannot practice social distancing if you're outdoors and anytime indoors is critically important. There are increasing numbers of reports of the benefits that we can get if we use face masks as a community. So wearing those masks is extremely effective and relatively easy to do. And then finally, just a good hand washing, not touching the face with unwashed hands, can also serve to decrease the risk. But it's very important, you know, when you think about workplaces, businesses, and other recreational facilities where people might gather, to take these precautions seriously. Again, because we're opening up, it doesn't mean the risk is lower. It means we have to do better to manage that risk if we're going to be successful.
Thank you. We have a follow-up question from Anna Boyko-Wyrock. Anna?
Yeah, I mean, if nobody else has questions, I always have more. So I'm wondering, you mentioned the increase among young people and how it's critically important to wear a mask and stay 6 feet apart. I don't know if you've been to Gasworks Park recently, but if you go, you will see a lot of young people who are not wearing masks, who are not staying 6 feet apart. So how are you going to make it cool for young people to engage in the social distancing that you say needs to happen so we can mitigate the transmission?
Yeah, it's a great question, Anna. I wish I had time to go to Gasworks Park. I'm looking forward to the day where I have time to go to Gasworks Park to relax a little, but I've heard the same types of stories. And a couple of things. First of all, again, it is important to understand that outdoors is much less risk than indoors. But even so, though, we don't want people gathering closely because transmission can occur outdoors when people are too close together. How do you make it cool? I don't know. I ask for your help in making this cool as you communicate to your listeners and to your readers and to your viewers. Clearly, people need to understand that COVID is going to be with us for a long time, for the foreseeable future, months, maybe years. So we really have to fundamentally reconfigure the way we go about our lives. And that means both the environment with respect to distancing and barriers and avoiding crowding in workplaces and businesses and other places where people tend to gather, but also doing things like erecting physical barriers, improving ventilation indoors, and the use of face masks, which is critical, and it does need to become the norm for now. Until we have immunity as a population, until we have a vaccine available, it really is the most practical tool, because the best and most effective is just staying home and avoiding contact. But we know we can't do that forever. We can't just all hunker down. And we need to get back to business. We want to get back to work, and we want to get back to the activities that we all love. But we will not be able to do that unless we take precautions. And wearing a face mask when in public is one of the easiest to take precautions that has great benefit. So I hope people do understand that not only is it cool, but it's responsible, and it really protects others in the community who I know everyone has others in the community who they know and love and would not want to see seriously ill. So using masks whenever out in public is going to protect those people.
Thank you. We have a question from Graham Johnson. Graham, if you unmute, you can go ahead.
Thanks again. And Dr. Duchin, I appreciate it. I want to just make sure I understand exactly the kinds of trends you are looking at in terms of whether we do need to make a change down the way. And as I'm understanding this, it's not so much, while it's concerning the numbers that you're hearing, because they're not resulting in hospitalizations and higher death rates, that we're, don't have to make a change. But I'm wondering how much wiggle room you have, because it's got to be such a tricky business to project this out a few weeks. If you did see, how much of an increase in hospitalizations or deaths would make you go, okay, we got to do something different here, whether it's a phase change, that sort of thing?
Yeah, it's a great question, and this is where we are lacking strong federal guidance and strong standards on when both when to move forward and when to move back. So we have to do the best we can locally and consider a lot of different factors. So, case reports and the demographics, or who's getting sick, is one piece of it. How many cases we're having, what age groups are they in, are they likely to get sick and require hospitalization, are they likely to transmit to others, the rate at which those cases are increasing, the trend, is it a steep increase, will it be sustained or flatten out, or will it start to decrease again? All those things are important with respect to cases, but we also want to look at our healthcare system capacity with respect to people seeking healthcare for COVID-like symptoms, people seeking hospital or needing hospitalization, and those needing intensive care unit treatment who are critically ill. And we really want to be able to have a change before we see any stress on our intensive care system, and before we see a stress on our healthcare system, so that they would be finding it difficult to manage the volumes. We want to make a change well in advance of that. So we have to look at early trends in hospitalizations and patterns of disease, and in also things like healthcare worker infections. Are we seeing more healthcare workers becoming infected because more patients are coming in difficult circumstances? These are many factors that have to be added together. There's not a single trigger, that's likely to jump the queue. The hospitalizations and intensive care unit utilization is something that's relatively late. So we wouldn't expect to, suddenly find us short on hospital beds or intensive care unit beds. But what we would see is an increasing trend in hospitalizations or intensive care unit utilization. That coupled perhaps with ongoing cases and perhaps outbreaks in the community and workplaces, long-term care facilities, and other institutional settings. Once we start to see any combination of those things that appears to be ominous, or that we're just having so many cases we can't keep up with tracking them and tracing their contacts, those are all warning signs that we need to do something very differently. And that really means stepping back and making sure we dramatically decrease our activities and our interactions with one another. So moving back towards the phase 1 type distancing, and we really don't want that to happen. And I think that if people understand that they need to manage this risk of COVID-19 by taking the ongoing precautions of distancing and mask use and avoiding unnecessary social interactions, we can avoid that. But I am worried that if people don't behave in the way that's going to decrease transmission, we may head in that direction. I hope that's not the case.
Dr. Duchin, and everyone, we are out of time. Was there any, I think you kind of hit your key message there at the end, but was there anything you wanted to add before we sign off?
I don't think so. Again, the key message is the risk hasn't gone away. COVID-19 is still out there. It will come roaring back if we give it the opportunity. There are things we can do to manage the risk, and if we want to move forward safely, we have to manage the risk. Stay away from others, wear face masks, avoid crowded spaces, avoid prolonged contact with others, and we'll have good hand hygiene. Just because you can do something doesn't mean you should do something. So everyone needs to weigh the risks and benefits of our actions and their impacts on the community.
Thank you. And for the media, if you need a recording of this, we will be very shortly posting that to the Public Health YouTube site. And a little later this afternoon, we'll have a media release that goes out. And when that gets posted to Public Health Insider blog, the audio will be and the video will be linked to from there as well. Thank you so much for joining us, and have a great weekend.
Thank you. Bye-bye, everyone.